Good evening. My name is Mallory Pilcher.
And I'm Brittany Toole.
Today we're going to talk to you about the CDC's tobacco-free campus policy. Before I get into detail about the actual policy, I want to talk to you about the CDC. CDC stands for Centers for Disease Control and Prevention, and their mission is collaborating to create the expertise, information, and tools that people and communities need to protect their health through health promotion, prevention of disease, injury and disability, and preparedness for new health threats. The CDC developed the Healthier Worksite Initiative. They developed this for their own employees. They wanted to create a worksite where healthy choices are easy choices. They use this to share their lessons learned with other people. It's therefore a resource for worksite health promotion program planners, and its purpose is to reduce costs to employers, improve employee health and morale. Now I want to talk a little bit about policies in general. Policies are formal laws, regulations, and rules that have been adopted on a collective basis to guide individual and collective behavior at the federal workplace. The CDC developed Policy 101, and it gives basic information on policies and their importance to the worksite health promotion planners. Policies actually promote employee health behavior. They offer incentives and increase access to resources. This enables healthy behavior choices. It's an impact on the worksite health promotion because it establishes boundaries for implementing wellness practices. Now we're going to talk about the tobacco-free campus policy. It's actually guidelines for tobacco use at the CDC worksite. It was established at the CDC for the CDC employees. Planners can use it as an example for their own workplace and their own tobacco-free campus policies. The goal of this policy is to improve health by promoting tobacco use cessation, and the statistics are what make this policy really important. 440,000 people die prematurely of diseases caused by smoking. 1 in 5 of the deaths in the U.S. are due to tobacco use. 44.5 million U.S. adults smoke. 8.6 million suffer from at least one serious illness caused by smoking. Cigarettes are not the only danger. Smokeless tobacco, cigars, pipes, Vitus, and other tobacco products also cause disease and death. This slide has a few pictures that are just going to re-emphasize the importance of this policy and the dangers of smoking. The risk from smoking can damage every part of the body. It can cause all kinds of cancers, cancers in the head or neck, lung cancer, leukemia, stomach, kidney, pancreas, colon cancer, bladder, and cervix cancer. It can also cause chronic diseases such as stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease, and asthma. It can also cause reduced fertility and hip fracture. This picture, it just explains the 44,000 U.S. deaths attributable to each year to cigarette smoking. About 35,300, which is about 8% of the deaths, are due to other types of cancer. 15,900, which is about 4%, are due to stroke. 44,000, which is about 10%, is another diagnosis. COPD is about 92,900, which is 21%. The big one is lung cancer. It's 128,900, which is about 29%. And then ischemic heart disease is right behind it with about 28%, and it's 126,000. This picture tells about some of the toxic chemicals in smoke that a lot of people don't actually know are in cigarette smoke. Benzene, which is found in gasoline, is in cigarettes. Butane used in lighter fluid is in cigarettes. Ammonia used in household cleaners is found in cigarettes. Toluene, which is also found in paint thinners, can be found in cigarettes. Cadmium, which is used in making batteries, is found in cigarettes. And lastly, hydrogen cyanide, which is used in chemical weapons, is found in cigarettes.
The CDC decided to create a tobacco-free policy, and the prohibition of tobacco use became effective on August 26, 2005. What the CDC classifies as tobacco use are cigarettes, pipes, smokeless tobacco, and other tobacco products. And these products are not to be used in any interior spaces that are owned, rented, or leased by the CDC. Also, the CDC said that tobacco products could not be used on any outside properties that are owned by the CDC or cannot be used in government vehicles that the CDC owns. Some places that the CDC owns, rents, or lease, but they do not have complete control over, decided to create their own tobacco-free policies. Some guidelines for the tobacco products that are prohibited are for interior spaces that are owned, rented, or leased by the CDC, in government vehicles, within 20 feet of building entrances and exits, within 20 feet of building air intake ducts, within 20 feet of the storage of flammable and combustible liquids or gases, and within 20 feet of dumpsters provided for combustible materials. Also, tobacco products are prohibited inside any covered parking space that is physically part of or connected to a facility where the CDC employees pass on a regular basis going to and from work. The way the tobacco-free policy is shown is by smoke-free zones, and these zones tobacco products are strictly prohibited. The way they communicate this policy for the public is they put signs around campus that say tobacco-free campus. And these signs are located by every vehicle and pedestrian entrance that a CDC owns, rents, or leases the facility. If the CDC does not have complete control over the facility, they do not place any signs anywhere, but they also do not place any ashtrays or smoking shelters for people to smoke. The CDC decided that tobacco-free policy is not going to do the thing. They need to be able to help their employees by providing access to medication, telephone, and group counseling for the employees who wish to stop using the tobacco products. It is the responsibility of all the employers or contractors or any students, visitors, to make sure that the tobacco-free policy is enforced and that no tobacco products are used on the CDC facilities. It is also the job of the supervisors to make sure that these rules are enforced and any violation of the rule that they take care of with the proper disciplinary approach. We chose this topic because GSW is not a tobacco-free campus, but they also do not enforce it. They discourage tobacco products on use on campus, and some of the policies that we found that this GSW posts for the students is smoking in buildings or on campus at any time is prohibited. Also, smoking and use of tobacco products are prohibited within 25 feet of a building. The designated smoking areas on campus and the individuals who choose to smoke must make sure that they extinguish their cigarettes or any tobacco products properly. And there should be no smoking within 100 feet of open-air facilities for the athletics such as softball, baseball, and soccer fields, as well as the tennis courts.
We just thought that this was an important topic that GSW should use since they are a tobacco-free campus, but they don't strongly enforce it. So that's why we chose this topic.